Our purpose in this video is to prepare the preceptors that are going to be working with the students at a clinical facility such as a hospital or a clinic. We're going to be addressing some of the different departments that students will be going to and discussing some of the things that we'd like for you to do as a preceptor with the student, as well as what the responsibilities are of the student while they're at your clinical site. First of all, it's critical that you know that without preceptors, our students could not be successful. And so I want to thank you for taking the time to be a preceptor for our students. What this does is allows a student the opportunity to be exposed to different types of patients, multiple types of patients, and have different opportunities in assessing those types of patients, as well as helps improve their knowledge of patient care and different treatment procedures that patients may experience while in a given facility or a specific facility. It also allows the student an opportunity to get to know the different healthcare workers, staff, nurses, doctors that might be working in those facilities, and it helps the student to understand the work environment that their counterparts work in and what is to be expected for each patient when they're in those areas. And this is a critical aspect for the students' learning. As well, one of the primary focuses for our students, as I've already spoke about a little bit, is that opportunity for exposure to patient assessment. We do want the student to have a good opportunity at assessing patients under obviously the watchful eye of the nurse or the doctor in that facility, and we want the nurse or the doctor to take the opportunity to give direction and guidance to the student as they develop those skills of assessment. This is an important part for all of our students to learn. The student, while in your facility, is going to be potentially performing different skills as well. Maybe depending upon the level of course that they're in. If they're an EMT basic student, these skills may be a little more simple, such as assessing vital signs on a patient, maybe opening an airway or ventilating a patient with a BVM, maybe doing compressions on a patient in cardiac arrest. In these opportunities, we do encourage you to encourage the student to step up and participate in these opportunities, as well as be assessed by you in their performance of that skill. And we do want you to give feedback to the student, as well as direction and constructive criticism and praise if it warrants it. This is where the student's going to develop and hone those specific skills. Additionally, they may, as advanced students, they may be doing things such as observing a live birth, or intubating a patient, potentially starting IVs or doing blood draws on patients. Even at the advanced level, they may be giving some medications in your facility if those things are approved by your facility for the student to do. We want you to observe these things and participate with the student. We know that you put a lot of trust in the student to be able to perform these skills, but your observation and assessment of the student is critical in each one of the skills that they may be performing. It takes a lot of communication, a lot of dialogue with the student to understand where they're at and what they're comfortable doing. So please take that opportunity when they're in your facilities to get a feeling for where the student is at and what the student needs to work on. They should come with that information readily available to you and should inform you when they get there where they're at, what their strengths are, what their weaknesses are, and what areas are needing improvement. So I am putting this upon the student to inform the preceptors, but please feel free. If you've got questions of the student, we want you to take that opportunity to ask those questions. Now I'm going to talk about some of the different departments our students may go to. Specifically, what they may be doing and what their goal is by going to these different departments. First of all, they may be going to the emergency room or the trauma center. In this department, their goal is patient observation, patient assessment, sometimes patient care, and observation of what the long-term patient care may be while in the emergency room or trauma center. The emergency room is also a department where they get some skill opportunity. A couple of skills they may have the opportunity to perform there are going to be IVs and blood draws and medication administration. We want the student to have the opportunity for all those if it's at their appropriate skill level. Realize that there are different levels students are able and not able to perform skills at. And so the student will identify with you what their skill level is when they get there, but they may be in the emergency room working to do the IVs, blood draws, and med administration. The student will also be going to respiratory or cardiopulmonary therapy. The goal for the student at the basic level is to listen to lung sounds. We want them to be able to assess patients with different respiratory conditions and understand what each lung sound may indicate. And so they should be listening to every single patient they come in contact with in the respiratory therapy department. As they begin to advance in levels, some of these students will begin to participate with other skills, such as assisting with nebulized treatments, breathing treatments. They will also be assisting with maybe suctioning or opening of the airway of the patients, and observing and participating with management of the patient's airway on a ventilator and by other means. It's critical that the student does have this type of an exposure. It is a large part of what the student's going to do in the field. Our students will also be going to CCU. In CCU, our goal for the student is to see the complex patient and to observe the patient and look at all the different aspects of this critical care. So we want them looking at the patient's chart, understanding the patient's history, understanding the medications the patients may be on, and the treatments that the patient may be receiving while in critical care. They're also going to be going to cardiac cath. And at the cardiac cath department, this is an amazing opportunity for the student to have that exposure to a detailed management and assessment of a cardiac patient. Many of our students, when they come out of this department, they have their eyes wide open to cardiac care, and it's an amazing opportunity for the students. And their students will also be going to pediatrics, and in pediatrics, this exposes that student to various ages of younger patients, and it also exposes the student to management with patients with family members involved and how to assess these patients, because they are a different type of patient, a little more challenging patient in order to assess and to manage at times. And so it gives that student that exposure in a setting such as a hospital. Our students will also be going to some other departments for specific skills and skill sets. For instance, the operating room, our students will go to this department to gain the opportunity of intubation of patients. What we need from preceptors in the OR is to communicate really well with the students so that the student knows what's expected of them while they're in their department, as well as puts the student at ease and gives them some direction so they will function at a higher level. The operating room is a very intimidating department for most students, and so by having some good communication, we generally see better performance from the students. Many times, if it's their first time, the student should be communicating this with you and letting you know that their skill set, even though it has been assessed and trained well in the classroom, has not been exposed to real patients at that time. Once they've had some exposure and begin to get comfortable with that department, we see significantly an improvement in their success rates in that department, where a student may go in initially one day and only have one opportunity. After a couple of times of going to the operating room, they generally go in and are able to complete 2 to 3 opportunities, and it's a great change, and it really is based upon the student's comfort and confidence. In the next department, it's our labor and delivery department, the OB department. In this department, we want the student to be exposed to a live birth, a live vaginal birth of a patient. It is okay if the student experience and have the opportunity to observe a C-section, but we're really seeking that live vaginal birth because that's what the student will be dealing with in the field. Our students will also go to the lab for the opportunity to perform blood draws and venipunctures. Our students have also been checked off on this skill as well prior to coming to this department, but we do want the student to observe on their first times of attending this department. We want them to observe the technician performing this skill and see what the process is in that department, and then allow the student to begin to stick, so that they, so by observing initially, they will have that confidence of the process, and they generally will do a better job. Most of our students do really well in this department. It doesn't take long to get that comfort zone for the student and for their performance to improve significantly. We also have students go to telemetry, and in telemetry, basically this is the opportunity for them to be exposed to rhythm interpretation. Our goal by going to telemetry is to fine-tune their interpretation skills. After seeing multiples of different rhythms, they tend to get a little stronger in this area. Our students generally come with a strong skill set when they first go to telemetry. They've already completed all their cardiac classes, and so they're generally relatively strong in this area, but they definitely need that fine-tuning, and there's really no better place than in a telemetry department where they can get that information that helps them become better at interpretation. The next component that's very important in this process is evaluation. Your feedback and evaluation of the student is critical. I need you to be able to be honest with the student and give them the positives as well as the negatives of their performance. The student is expecting this from you. They have been advised prior to coming to clinicals that they are to ask for this from you. No student will improve unless they're given the tools to improve. And so the way that we want the student to be able to improve is to get that feedback from you about how they were performing. If it's about patient assessment, if it's about their critical thinking, if it's about their behavior, it's about their dress, their attitude, anything you see that you can point to that's going to define how well-rounded this student might be as an EMS professional or a healthcare professional, we want you to give the student that feedback. So at the end of the day, they're going to provide you with an evaluation form. We've asked them to provide it to you early enough so that you have the time to sit down with that form and fill out that evaluation form. So we ask that you take that little bit of time. Now, on there, sometimes you may not feel comfortable giving, some critical evaluation. If you feel like there's something that is a little too critical and you don't feel comfortable writing it down and giving it back to the student, I understand that. That's a hard thing sometimes to do. So please feel free to give me a call. I will write down those comments and write down what you give me, or you're welcome to email me, and I will take that as well into consideration. I will document that as well for the student, because we want them to improve. We want to be able to give them the tools, and we realize that your feedback is crucial in this process. Don't be intimidated. Don't feel like you're going to hurt their feelings. They're expecting your honest evaluation. But at the same time, give them the praise. If you see that there's positive things, we want you to give them that praise as well, because it means a lot coming from you as a preceptor. They look up to the preceptors that they're engaged with at these clinical sites. So thank you again, and we look forward to working with you in the future.